The shoulder is a really big problem. It's a big deal. And the reason that's a big deal is because babies, and this is something that happens in babies that doesn't happen in adults, is this internal rotation posture. And there's a lot of work that's been done on why that happens. It turns out that these affected muscles don't grow as quickly or as well as muscles that are not denervated. And you really can't leave a baby like this because their shoulder will deform. And this is what happens. You get this posterior shoulder dislocation or subluxation. And this has been well recognized as a complication of brachial plexus birth injuries, described a long time ago and continues to be described. And you can think of it like a golf ball on a tee or ice cream on a cone, and it's kind of falling off. And you can see it's not really new, right? 1913. And what happens is, if you go to the next one, Aaron. So what happens is that the shoulder is balanced towards internal rotation, turning the shoulder in, and it's not balanced to go. It's has very few muscles, only two that give you external rotation. And so if you denervate those two muscles there, the teres minor and the infraspinatus, then those muscles are not going to function, and it's going to tilt the whole thing towards internal rotation. And then the head will sublux.
Dan, do you just want to mention, these boxes represent the muscles of internal rotation, the latissimus dorsi, the teres major, the subscapularis, and the pectoralis major.
Yeah.
Just for those families that may be wondering what the letters mean.
What the boxes are behind door number one?
Yeah, exactly.
Yeah, I appreciate that. And then there's something called the Hooter-Volkmann law, which says that compression forces inhibit growth and tensile forces stimulate growth. So basically what this means is if you take that golf ball and you put it towards the back of the joint, right, then it's going to put pressure on the back of the joint, and the back of the joint will not grow as well because the cartilage will be stunted, and the front of the joint will grow, and you'll get this sort of angling of the joint that you see there. And so this is what it looks like on an MRI. And you can see that if you imagine the T, you can see that the T has deformed and the ball is starting to slide off the T. And so this is accompanied by loss of passive external rotation. And what we've seen is if you can't get the shoulder to neutral or past neutral, that's a sign that your shoulder is really in trouble. The MRI remains the gold standard. Ultrasound has been validated for use up to 1 year of age. And we still use ultrasound as a screening tool, and we use MRI as a preoperative tool. Again, MRI is a preoperative tool for us, not necessarily a diagnostic tool. Okay. So our friends in Helsinki, Petra, Antti, and Uriana have come up with this whole protocol for dealing with shoulder, because the best way to deal with this dysplasia of the shoulder is prevention. And this is what they've described, and this is what we use, which is the teapot brace. And it helps to keep the shoulder in external rotation so that the cartilage has central loading and doesn't have that, loading in just the back of the joint that forces it to deform. And what they've seen, if you go back to that slide for a second, Aaron, they've seen their rate of surgery decrease from about 30% to less than 10%. And I will tell you that we used to do about 2 tendon transfers in the shoulder a week. Now we do, if I do 1 a month, that's too many. So it's for us, it's more than that decrease.
So this is pretty huge. I mean, I'm hoping like clips like this out of the video we have here will be something that people can share and things like that, because this information, this research, makes a huge difference, in the context of doing something that's not as aggressive as a surgery, but is, it's a passive, but it's like restrictive passive, or I don't know what the medical terms are for it, but I just think,
yeah, and it's great because it's only during naps and nighttime. So
wow.
The baby still has time to develop their muscles and their shoulder. You don't want to put a baby full time in a cast like this for an extended period of time, but I will use a teapot brace up until 2 years of age if I feel that the child is still at any risk of loss of shoulder function. So, and that's really, that's changed my practice entirely.
It's amazing.
It's
just keeping it in place, basically, that what it's doing, or keeping it
yeah,
in a
yeah, it keeps
normative place.
If you go back to the Hooter Volkmann picture, what it does is it puts the ball in the center so that it doesn't compress the cartilage in the back of the joint, and therefore the cartilage grows evenly.
That's brilliant.
And without that deformity, once you get the child to about 2 years of age, whatever their shoulder shape is going to be is pretty well preserved from then until its maturity.
Yeah.
Okay. Yeah, no, it's great. So the other option is the super splint. The super splint stands for supination external rotation. One of the problems that these kids have is they lose external rotation, but they also lose supination, right? So the idea was, and then the third thing is elbow extension. So they get elbow flexion contractures, they get supination loss, and they get loss of external rotation. And so the idea of the super splint is one brace to do them all. I'm about to run out of battery. Hang on one second. Marie, could you get me my the plug? Thanks, love. So, anyways, it's in my bag. Yeah, thanks. So the other problems, it's hard to control external rotation in the with the elbow and extension, because it's trying to basically control the rotation of a tube, right? And it's hard to stop a tube from rotating. But if you have a kink in it, like a bent elbow, that's an entirely different thing. And so that's why we use the teapot brace and not the super splint. And the other problem that we've seen with the super splint is that there's been dislocation of the radial head, and we've seen that more than a few times at this point.